Thanks. Well, welcome to all of you who have joined. Again, today's webinar is about developing campus and community linkages, and we'll be having a pretty interactive panel discussion. So I hope that you feel free to keep using the chat as we go through the webinar. And I'm Sheila. I'm a campus prevention specialist at SPRC. Many of you I've probably talked to on the phone or you've gotten emails from me. So thanks again for joining. And I'm joined by Carrie, and I'll let Carrie introduce herself.
Hi, everyone. My name is Carrie Smith. I'm a senior campus prevention specialist, and hopefully all of you have heard me before or seen the many emails I send you guys. So welcome, and I hope you enjoyed today's lively discussion.
Great. Thanks, Carrie. And then I'm going to go ahead and just let you know who is joining us today, and they'll introduce themselves a little more in depth in a few minutes, but we're joined by Michelle Scott and Franca Mancini from Monmouth University in New Jersey, Peggy Glider from the University of Arizona, and Livier Martinez from Mount San Antonio, and they will be your panelists today, so we'll be hearing much more from them shortly. So I'm just going to start off by talking about why our campus and community linkage is helpful. So one of the top reasons we hear through counseling director surveys or just anecdotally is how burdened counseling centers are with the amount of need that students have, and that exceeds the capacity that the counseling center is able to provide. So, whether that's in students who need longer term services or just increased demand because of a lot of the awareness and training that a lot of you are successful at doing on your campuses. Secondly, there's a lot of colleges who have possibly limited or no mental health services on campus, so that makes it even more important to have a strong network of people to refer students to when they do have needs that can't be met.
I had agreed to...
And then lastly, staff who are just wearing numerous hats on campus. So you may be working in the counseling center, but you may be doing other outreach or prevention work. You may be serving on various committees and involved in many different roles. So it's not only the counseling center and students' mental health that you're focused on, but several other obligations. And so those are a few of the reasons that we have, but I'm curious to know what other reasons do some of you who've joined today think that it's important, why it makes it important to work with your local community. And you can go ahead and just use the chat box, and I'm just curious to hear what are other some reasons behind why you're motivated to work with your community. Easier for students to get help from the community. Strengthen the partnerships in the community. Mary said, as a commuter campus, our students go home into that community every night, so working together helps provide seamless care. So we have a lot more commuter campuses and community colleges in this group, so there might not be that, um, hard distinction between campus and community. And are there any other reasons that people have for why you're motivated to work with the community? Specialized services is needed. Okay, great. Go to the next slide. And our first question that we're going to pose to our panelists today is, who have you partnered with and why? And I've asked each of the presenters to say a little bit again about, what campus you're from, where you're located, how many students you have, and what services are available, and then talk a little bit about who you've partnered with. And so, Franca, I'm going to go ahead and get started with you.
I just
Hi, this is Franca Mancini, and I direct counseling services at Monmouth University in West Long Branch, New Jersey. And we're, I guess you'd consider us a moderately sized university on the Jersey Shore. And we have a number of graduate programs as well. And I have a staff of six licensed, including myself, six licensed clinicians, two of whom are part-time. They make up one full-time equivalent. And what has been helpful to us in terms of who we've partnered with off campus, the most important partnerships that we've been able to establish are with the local hospitals, the local healthcare systems. So we've been able to establish the connection with the St. Barnabas system, which has been extremely helpful because the the psychiatric emergency screening service is located very close to school, but it wasn't very helpful until we actually partnered and came up with procedural understandings or MOUs. And then at a slight distance, maybe about 15 minutes from the campus, a Meridian Health System links us to a number of different hospitals in the area. And a lot of this is related to the crisis work that we do, because in terms of counseling, we're pretty well covered, but in terms of suicide crisis in particular, we need to get some assessment and get a student to a safe place pretty quickly. So that's been helpful to us. We have a lot of private providers also in the community that we've partnered with, and that's been extremely important as well. And then this may seem obvious, but I really want to emphasize the importance of establishing really clear partnerships on campus as well, because that has been priceless. Having real partners who understand what we're trying to do and kind of creating a real network on campus from a communication standpoint has been very, very important.
And Michelle, I think you were going to say a little bit more about the campus partnerships.
Yes, and Michelle Scott. I'm one of the directors of the Garrett Lee University, and I'm a researcher. So my evaluation experience and my partnerships have included, first of all, some more community-based, county-based. So for suicide prevention, everyone is responsible for this dynamic. We talk about a lot of partnerships with the county, as well as local and state leaders. And that's a really important thing in order when we have discussions and try to get policy and things discussed and implemented. Furthermore, when we do trainings on this, we feel that partnerships are really for taking a social work kind of approach of having buy-in of the people you're trying to work with instead of doing that top-down approach. The partners, when we send out training invitations and things like that, we partner with, I mentioned, partners that can't support. So if we're trying to invite faculty for things, we get something called CETO, which is our Center for Excellence in Teaching and Learning. And when you do that, they send out the invitations to the trainings to get more buy-in. And same with like athletics, it comes from the athletic director to the coaches and things. So our partnerships work not only clinical, but in terms of getting our education mission and policy mission in place.
Great. So there's a wide range of people in your community that you've just mentioned. That's really great. Peggy, I'm going to go to you next to hear a little bit about who you've worked with in your community.
Okay. I'm Peggy Glider. I'm the coordinator for evaluation and research with our campus health service, and I'm also the project director for our Garrett Lee Smith grant. Our campus has about 40,000 students, undergrad, graduate, and professional. Our counseling service is actually fairly large. We have about 20 counselors on staff, not all full-time, but 20 certified counselors. And because we have a lot of services on campus, students don't necessarily understand why they might need to go to the community. So we really work very hard to build the relationships with the community so that the students, again, see it. Someone said the word seamless, and that's really what we try to do, is create a seamless approach. Those in the community that we work with very closely are social service providers, most who work on a sliding fee scale, since some of our students don't have insurance. We also work very closely with community agencies like NAMI and our Southern Arizona AIDS Foundation for other support services, not necessarily counseling, but other support services. And we've worked very hard to build those relationships. The only formal MOU that I'm aware of is with our emergency department for the University Medical Center, which is right off of campus. Other than that, they're really informal agreements between the university and the community providers. But we really have worked hard to build that network and do it in an in-person way, which I think is critical. We have a case manager who really works face-to-face when there are new providers in the community or agencies change, which happens with funding, to make sure everyone knows who we are, what we do, and how we can refer to them and how they can refer to us if they work with a student that they think would be better placed just here on campus. I also want to stress the importance of on-campus partnerships. We've worked very hard to get a broad array of folks on campus to really know what we're providing so that they can make referrals, and we can do a lot of prevention and key stakeholder gatekeeper training, those kinds of things. So I'm not going to go into the whole laundry list because most of that's already been mentioned, but those are really the key players that we work with.
Thanks, Peggy. I should also mention to the participants, we are going to have a Q&A at the end, but if you have questions that come up as a panelist is talking, please feel free to just chat those in, and we'll try to get those addressed right away, so I could just jump in and have the panelist respond to your question if you think of something. So feel free to use the chat box in an ongoing fashion. So, and then lastly, I'm going to go over to Olivier, and if you could tell us a little bit about your campus and some of the partnerships that you've developed.
Sure. Hello, my name is Livier Martinez. I'm a licensed clinical social worker at Mount San Antonio College, and no, we're not in Texas. We are actually located, it's a community college in Southern California, and we are located 30 miles east of Los Angeles. I'm actually the program supervisor of the SAMHSA GLS grant. Our campus is quite large, very, very actually large. We have about we go between 50 to 55,000 students total. We're the largest single-site community college in California. And that's a combination of the majority, about 38,000 students are credit students, and then the other population is non-credit students. Counseling services is located in the health center. So we don't have a separate counseling service. And the health center houses counseling and also the medical services that we provide for students. Unfortunately, our counseling services are not super, super large. I am the only full-time therapist, and we have 3 other providers, and they're just part-time hourly therapists that come in 3 days out of the week, and they cover a total of 26 hours. So as you can imagine, by the number of therapists we have and the population and the number that we cover and that we try to service, having partnerships with our community providers is integral because of the large population. So we have listed numerous community agencies that provide services beyond our care. And I didn't mention this, but we only provide short-term counseling. And so what we are able to do is we have worked with counseling agencies in the community, substance abuse counseling agencies also in the community, in particular one. We also have a pretty good relationship with our local psychiatric response team to call them when we need a student to be further evaluated for a crisis. And the same with Peggy had mentioned, we definitely work closely with our inter-campus departments, public safety obviously a lot when we do a lot of gatekeeper training, and just the campus at large, and then with public safety on having them make sure that they can respond effectively when the staff, health center staff is not available. And I don't want to repeat some of the same things that have been mentioned, but like I said, we dip into a lot of our community providers to offer services to the students that we cannot provide services to.
Great, thanks, Livier. It's so interesting to see, 3 different campuses in 3 different settings and having different reasons for why you need a partner, or what kind of motivated the partnership. And so I see that Denise has typed in a question into the chat box. Our students who are referred to community therapists sometimes interpret this as my problems were too severe for the counseling center to handle. And so I'm going to see if our panelists want to take that on. And Peggy, I think maybe that you had a response.
Um, Actually, my question was just how you wanted us to handle it. But in response to your question, um, I think that sometimes that is an issue here as well. We have a number of students that don't really want community referrals. They figure we have a counseling center and we should be able to meet all their needs. So it's really working with them to understand that it's not that they're in such bad shape we can't handle them, but we have 40,000 students to serve, and we need to share that responsibility with some community agencies so that we can best meet the needs of all of our students. And so we will see them here, but we may not be able to track them for more than a few appointments. And so that's kind of the way our case manager handles it, because she's the person that really works to get them connected to the community. So she has long conversations with them about why. And she seems very successful with that approach.
If I could speak to that briefly as well. Um, we, this is Franca, and we run into the same difficulty, and in our disclosure and informed consent form, we talk to students up front about being oriented towards shorter-term counseling and also really needing to assess whether or not they can be best served here on campus or elsewhere. So, we try to set really clear boundaries and discuss that with them from the beginning. And then we bridge them while they're getting connected. So, they don't feel that they have been just kind of abandoned. We try to provide some services. We clarify to them that in the event of a crisis, they're always welcome. But I have found that being really clear with them about what the limitations are in terms of the counseling center has been very helpful. And again, supporting them through the transition to the off-campus provider seems to, for most students, seems to work. I mean, there's some that come in and they just want to be seen on campus, but that's not realistic.
So it sounds like kind of smoothing out that process of transferring them over, and looks like using a case manager is one of the strategies that Peggy had mentioned.
Mm-hmm.
And then Livier, I think you had something that you wanted to add as well.
Yeah, and wow, Peggy and Franco just touched on everything that I had thought about exactly. Same thing that we try really hard to obviously not that it's, that it's too severe. Of course, we're licensed clinicians. We should be able to treat them. We understand that, but it's not, it's not that we can't treat them, it's the setting. So
Mm-hmm.
we do try to, we do try to clarify with the students and being very clear from the very beginning in our informed consent also, so that students, when they walk in, and that they know right offhand that it's not something, oh no, we can't handle this, we're gonna we're gonna punch you to somebody else, but it's like we're just, our system is not set up to oversee somebody that has a higher level, a need for a higher level of care. And I always go back to that. We want to make sure that you get the best treatment possible, and somebody that's going to be able to see you possibly in a longer term, somebody that will be able to track you, not have the, the holiday breaks, not have the summer breaks. So I try to point it in that view as well, that it's also for their benefit. It's not just because we don't want to be bothered with them.
Great, thanks to all of you. Those are really great responses, talking about managing the expectations or the perception of, why we are linking to the community. So I want to go back to getting some input from the participants, and I'm curious to hear about, sorry about that. I'm curious to hear about who are some partners in the community that you've identified, maybe potentially different ones than the presenters had, talked about, community agencies or hospitals. Are there some other partners that all of you on the line have found yourself working with? CFIS police and local support groups in the community. Great, thanks, Alan. Those are both really important groups to reach out to. Local crisis services and the local community suicide prevention coalition. Thanks. So it looks like the local crisis line, local LGBT center, DHHSIVPB. I think I should know what that is, but Willa, could you maybe type that out for us? And also the VA and local domestic violence agencies. You're in the process of developing MOUs with the tribal programs and the local helpline. Great. VA as well. So I know many of you are trying to reach out to your student veterans on campus, so the VA is an important partner. Okay, great. The Violence Prevention Branch at the Department of Health and Human Services. Thanks. Interested in learning a little bit more about the nature of the partnership with the VA. I'm not sure if any of our panelists have had experience with partnering with your VAs. Maybe Tom, you could say a little bit more in the chat, or feel free to connect offline and after the webinar as well. Other Garrett Lee Smith recipients, so maybe your state grants or other campus grants in your state, the local chapter of NAMI, churches, PFLAG, so parents, family, I always get this wrong, parents and friends of lesbian and gay individuals. LGBT people, great. So we'll just do another minute or two to see if there's anybody else that has had some unique partners. This is such a diverse range. It's really interesting to see who some of you are working with. So Jeannie's mentioning the suicide prevention coordinator at the regional VA. Mm-hmm. So did you want to say a little bit about the VA office on your campus?
On our campus, we have a coordinator of veteran services, and we do have connections with this is Franca. We do have connections with the local office for clinical needs, mental health needs of veterans. So it's been relatively difficult to actually work with the vets because they tend to prefer literally going off campus and working with off-campus providers. But having a collaboration with the coordinator with whom they will speak, him being a vet himself, has been very helpful. So we kind of use him as the liaison and funnel information through him, and we've been able to assist them in getting them connected to the local mental health office for veterans that's not too far from campus, actually.
Mm-hmm, mm-hmm. Great, and I think I've heard that it really helps sometimes to have some of your veterans representatives really be able to connect their own personal experience in serving with the students.
For us, that's been very important. They work better directly with the coordinator than, honestly, with the counseling service on campus.
We have a counselor from the vet center, this is Peggy, I'm sorry, that actually comes to campus several days a week to do counseling in our student vet center. And so we work collaboratively with them, but they actually don't come here to the campus health service to our counseling department. They actually receive the services if they want to. They're in the vet center. And that really has expanded our reach to the vets a lot. Even though we have counseling staff that are vets, but just the perception is difficult sometimes to overcome.
So I'm going to move us to our next question for our panelists. So this one I'm going to have Franca and Michelle speak a little bit about. So how have you built your referral network? And we heard a little bit about the partners that you've had, but I think you have some more, words of wisdom on exactly the process of how some of those relationships have developed.
I can speak to that a little bit. This is Franca. Excuse me. I think initially one of the things that was important was to just sit for a moment and think about, because I think the partnerships are both, as we said before, on and off campus. On campus, identifying who I would call frequently to solve problems and who would call me when they were in trouble helped me identify the people that I could start the conversation with and build a strong alliance, really, a number of allies on campus. And then the same thing with regard to the kinds of problems that arose with various students. Who would I turn to into the community? So we have MOUs with the two hospitals, but we do have similar collaborations with other offices that have already been mentioned by the other panelists. And it really came down to thinking about who was part of the solution, who can help me make this happen. What I think I had to realize was that it wasn't going to be a fast process, that both on and off campus, it was going to be a process that came about through repetitive contact, communication, helping people see why they were an important part of the solution and how we could help them as well, because it was reciprocal. Many of our partners are happy that we can provide some information when we have a student that we need to, connect them to. And it turned out to be mutually beneficial. So the partnerships grew as everyone began to realize that we really did have a common interest. And I think that's such a basic theme, but for us it was a key element in really establishing the kind of networks that we have now. And with regard to the larger issues, on a county, state level, national level, we've tried also to have the counselors, and Michelle can speak a little bit more to this, to represent on different groups. I'm part of a county group with regard to suicide prevention and just disaster relief in general. She's connected on multiple levels. So it's very hard to leave your office because we're all overworked and we're stressed out, and we think it's impossible, but it's really important to make these connections, create some personal connection, because you will find that people will support you and they will be able to identify the common denominator. Michelle, did you want to add something?
Yeah, so I think, Franca, you've covered a lot of it, and what I wanted to say is really one of the things with our advisory board, really building not just a working group on campus of key leaders across the different areas to buy into our work and to really be part of sending the message of promoting wellness and resiliency on campus. We have a community advisory board, and we built those pretty much basically, like Franca had said, it's identifying who you already speak with, who you already feel that they could benefit from the work. So it's a mutual partnership. It's not that we're just taking or giving them more work to do, but hopefully the work that we do on campus will complement that they're doing either, like the County Mental Health Association is a key member of our advisory board. Some of the other community and county and statewide programs. I noticed somebody had said their local like Suicide Prevention Coalition. They're a key person that we include the Mental Health Association and other county level, not maybe the whole state boards, but that's really an important referral network in terms of not just clinical, which Franca mentioned, but also to get the message out and have people come in and support us as we support them.
Could I add one last thing?
Sure,
That
go ahead.
I just wanted to add one last comment that I initially overlooked and I think turned out to be really important. Um, Counsel, if you have access to counsel, legal counsel, university counsel, college counsel, whoever you can work with or whoever works with that person, if you can't get directly to that person, try to get through to them, because if you can get counsel on board as well and they look at some of the other issues that are relevant, you know, we're human services workers. We're trying to do the clinical. We're trying to help people. We're trying to get them the assistance that they need. But we're still working within larger systems. And if the administration can see that this is relevant, and when I talk about university lawyers, clearly I'm making an indirect reference to liability issues. If they can see that these partnerships are helpful, they can facilitate that process, and that happened to us. It started to make sense to them. So we weren't operating in a void, but we got buy-in on a lot of different levels. I just wanted to add that because I didn't see it right away, and then I realized that it was very helpful.
Great, thanks so much. Yeah, it definitely helps to have the University Council on board. You're a great partner. I'm going to move to our next question for the panel, which is, how do you maintain your ongoing communication? And Peggy, I'm going to have you answer this one because I think you had some interesting ideas.
All right. We maintain pretty constant communication in a number of ways. We have a fairly large advisory group for our grants that consists of both campus and community members. As an aside, this is the first time when we put an advisory group together that it keeps growing instead of people getting all enthused and dropping out. But it's a very vibrant group that really has helped to direct a lot of what we're doing, so we do strategic planning with them and do updates. But I also do very frequent email contact with all of our advisors, and then they share that with their departments. So anything that comes out from SPRC, for example, if there are webinars going on or whatever, I make sure that that information gets out there. They also use the advisory group to share with each other. So they'll send an email to me and ask me to send it out to the membership. And it's been a great way of networking not only between us and our collaborators, but amongst themselves as well. And I think that's been a very exciting aspect of this project. We've had a lot of advisory groups on other grants, and they usually kind of fall apart when the grant goes away. But this one's not going to go anywhere. This is going to be an ongoing group. We also have a Southern Arizona Suicide Prevention Coalition here in Tucson that I serve as a member of, so that we can reach those that aren't able to come to our advisory group, but then we meet with them. And I think that's also important. You have to do the face-to-face, and that means getting off of campus, which was, I think Franca already said that. But it's important to get out there. Sometimes there's that sense in the community that university thinks they're too good for everybody else, and we certainly don't feel that way and don't want that to hinder getting our students the services that they need. So we really try very hard to work with the group. We also work statewide with the person who's in charge of all the prevention dollars for the state. And that has been a huge help. I serve on 3 statewide committees now for different things. And again, just building those partnerships, because she may know of someone even in the community that's new that we don't know about because they've gotten funding or have contacted her for information or whatever. So keeping that line of communication open has been very helpful. I think the other thing that is helping for ongoing communication, as I mentioned, our case manager really does a good job of keeping up to date with who's doing what in the community. So as the players change, whether that's individuals or organizations, our case manager really takes the time to meet face-to-face with them, build that relationship, and I think that's a critical piece as well for the ongoing communication.
Great, thanks, Peggy. And it looks like we had a question come in too. Willow is asking how many is fairly large.
For our advisory group, we have about 40 members.
40 members, okay.
which to me that seems like a fairly large group. Usually they're 15 to 20 in my experience.
Thanks. And so we're going to jump back to, thanks to Peggy and Franca and Michelle so far for some of your responses, and we're going to jump back to using the chat to get some more input from the participants. So curious to hear from all of you, what challenges have you had in working with your local community? And so I think Denise had mentioned something in the chat a little bit before about the perception of that students see how referring out to the community can create. So I'm wondering what other challenges have some of you had? Feel free to go ahead and type into the chat box. People not responding in a timely manner. Or not at all. Yeah, that's always frustrating. Other folks are typing as well. So you're new and just getting started, so maybe trying to figure out who you should be partnering with and how that process should work. Someone else just getting started as well. Okay. Coordinating schedules. Yeah, lots of busy people out there. So finding common times and anyone that's doing teleconferencing for meetings. Sure, Franca, did you want to add something? The mobile crisis unit has a different idea of what constitutes an emergency than you do. I see a few other people are typing, so we'll just give another 30 seconds or so. So difficult contacting someone to partner with at larger organizations like Social Security. Sometimes the group that you want to partner with is not well formed themselves. And some legal issues, so HIPAA and FERPA, things a lot of you are probably very familiar with. Creating barriers to communication and reentry. Mentioning overwhelmed emergency rooms and psych units. Lead to extreme difficulty in finding a unit. So you may refer to the community, but they may be just as overburdened as the counseling center is. So another vote for the privacy issues and legal barriers. Great. Thanks to all of you. So we're going to go back and hear from our panelists one more time. So the next question is, how have you formalized your relationship? And Olivia, I'm going to have you share a little bit about how you've gone about doing this.
Okay. Thank you. That's perfect. One of the agencies that I had mentioned earlier, like I said, we work with a lot of the community agencies, is we reached out to a local substance abuse counseling agency that provides different levels of care, from outpatient, residential, day treatment, medication, and multitude of supportive services. And we've worked together with this agency for many, many years. And thankfully, the grant just really pushed us to begin to formalize some of those relationships. And we reached out to them. We invited them to participate in our advisory board. I know that's been a topic here, and they accepted. And then we also approached them in establishing an MOU, formalizing what we already do, and they were very receptive. And the process, I know that was brought up in terms of how did we go about, formalizing the process, and it's the first MOU that we have with a community agency. And what we did is I reviewed some MOUs that had been established from other agencies. I reviewed what we needed, and then I began to draft. What was I expecting this community agency to do, and what were we going to do also for them? That was very important for us to say. It's not just what you could do for us, but how can we work together? And in the MOU, I did outline, that this agency was going to participate on the advisory board, that we were seeking their input, their expertise in their area, that we were seeking their input, their information, and their guidance. And also they're also coming in with a different perspective. We work on a community, we work on a college campus. They're coming with a different lens, viewing it from a community perspective, and that was very helpful. We have asked this agency in the MOU to also participate in some of our functions, like our yearly health fair, to also provide, if we needed them to run a workshop or an educational seminar on anything related to substance use. We also asked them to serve as our consultants when and if needed, obviously, again, calling on their expertise. We also list them on our community resource. We also reach out to them as one of our first go-to, because I had mentioned the level of services they provide. So when we have students that come in needing substance abuse counseling, we go to them a lot. So listed in our MOU was pretty much our expectations and what we would also be willing to partner with them. So we listed them as that we can also consult with them, that we would also participate in their events, and that has also worked very, very well, because it's really gotten me out into the community and to participate in some of the stuff that they have done. Their quarterly breakfast, where I get to meet other representatives from a multitude of agencies, which again helps me in making our list of resources, wider, longer and longer, which is great for our community college campus. So drafted this MOU, had our people look at it, had their people look at it. Once we were okay with, everybody agreeing to everything that was listed in the MOU, it's now sitting in our board, and hopefully it will be approved actually this month. I'm hoping at the end, not next week, but the last week in November, and I'm hoping it will be approved and we will have our first MOU. So that's pretty much the way that we went about formalizing our relationship.
I think what's interesting about how you've done it is it's not only MOUs for clinical capacity issues, it's MOUs about participation in events and just showing support, so that's really neat.
Yeah, well, because I knew that was one of, actually, if I could just speak to that, I knew that if I went to them just with the clinical, they were going to say, I mean, I couldn't make them. I couldn't force them to take our students without any health insurance, and that they were going to agree to see them. I knew that was not going to be the way to go with this particular agency. They had already expressed to me, they're like, we have minimal funding, we don't have a lot of money, and I mean, again, lots of stuff that we already know, but we didn't want to have that be the thing to turn our relationship away. That it's like, okay, but how can we still continue to work together? And again, we had already had this relationship. This agency has been coming to our health fairs. We always refer students to them. This relationship had already existed. It was just now formalizing it and putting it on, on paper in a document.
Mhm. Mhm. And I wonder, Peggy and Franca and Michelle, if you just have, we just have a couple more minutes before we, save some time for Q&A, but do you have anything you want to add about MOUs or any of you, any sort of last words of wisdom about some of what we've talked about today?
Well, this is Peggy, and we've taken a similar approach to MOUs. As I said, we only have one as far as a formal MOU with our emergency department, but we have MOUs with our advisory group members about participation, that they will post media if we have it. They'll come to meetings. They'll go to events. So very, very similar to what Divya already has talked about, but we really felt we needed to build those components in so people felt like they had the same vision that we have.
This is Franca. With regard to the MOUs, I wanted to just mention, I know that sometimes they're really cumbersome. It takes a while to get them in place, but the importance of the MOUs that we have right now, besides just the other collaborations that exist, the MOUs have been really important in terms of facilitating reentry, because we worked with our partners enough to actually have them understand what would be required for the student to come back to campus. And we've reached a point really where when they're done at the hospital actually calls us to set up the reentry appointment. And so we've been able then, with a good MOU that we as mutually agreed upon, we've been able to really make reentry very smooth and keeping the student connected to services that, increase the possibility of success on so many different levels, make that a reality for many students. So, and they've seen that as a carrot in terms of what they can say to the students in terms of the collaboration with the university. We're going to work with the university to get you back on campus. And in fact, our crisis policy is actually posted on our website. So, anybody who wants to, whether, the public at large, future students, whatever, it's very clear about what we will do with regard to a mental health or substance-induced crisis. And those are the same guidelines that the partners agreed to. And it's, as I think Peggy stated, I'm not sure if it was Peggy, but somebody stated, it was very clear what we would do and what they would do. So covering both aspects is important. But it's been important in terms of facilitating reentry because we want to get the students back in.
So we're just, about 10 minutes away from wrapping up, and I'm wondering what questions people have who are on the line for the panelists, or and if you can go ahead and just type them into the chat box, that'll be great. Or typing. And if anyone had challenges that you thought of, or, great, thanks, Mary. It's always nice to hear that people find it useful. Thanks. Anyone who could share sample MOUs?
I will.
We can.
Yeah, I can too.
So we'll work on, Rita, maybe you can connect with your prevention specialist about coordinating some of that after the webinar.
This is Michelle. I just wanted to say in terms of closing comments, somebody had said before one of the challenges was getting started and getting everybody on the same page. And I know we talked a little bit about MOUs, but even before that, I think one of the things that I think Franca has been so successful, of course she's done this longer before I got to the university, was again trying to find that mutual benefit. It's almost a marketing skill. Like if you're trying to get somebody to be part of your group, it's not because you need them. You need to figure out a way that you can help them too. And I don't think we're talking about something that people haven't thought about before. But if you think about it, I know we go out and like, oh, we have to get this done. But if you can stop and say, what could we offer you? How would we make your life easier if we did this or you were part of it? Then you may be more willing to come to meetings. And even we have a listserv at Monmouth University. So when we want to talk to our group or they want to talk to us, they can post to the listserv. And we can share information that way. I think Livia said that as well, or somebody, Peggy, also maybe mentioned listserv or the way they communicate to their boards.
And the other thing, this is Sheila, that I should mention is besides the SPRC listserv, I do want to mention that all of you, who had set up logins to access the SPRC website, the private pages is a great area where if you have sample MOUs or other documents or products that you want to share with other grantees, it's a password protected area, so only other grantees can see them. It would be great to, I just wanted to remind you to use that area and that space, which is created for you. And so if there aren't any other questions, I just want to thank all of our panelists. And I know I found it really interesting listening to you and working with you for this webinar. So thanks so much to you for your rich feedback and perspective. And I'll just go on to the next slide. I'm actually going to pass it over to Carrie. We do have the panelists' contact information at the end of the webinar, their email addresses, and this webinar will be recorded and all that. So, but let me pass it over to Carrie to just talk a little bit about the next steps for the training program.
Great. Thanks, Sheila. So this was actually the last webinar as part of our SPRC training program for new grantees. So there'll just be one other thing that's left in the training program, which is I'll be sending out in the next reminder a link to a really great online training that our Training Institute has created around choosing and implementing a gatekeeper training program. And some of you may have already chosen a gatekeeper training program, but it's a short online module that only lasts about an hour and walks through some planning considerations. So it's a really useful tool even if you've already decided just to look through, and it also includes a really great matrix of all of the gatekeeper training programs that are listed on the best practices registry. So look for that in the next reminder email that I send out next Monday. And also, I just want to thank everyone for participating. I know you have very busy schedules, and this has been a really hectic beginning to your grant, so we really appreciate you participating, especially with all these lively discussions throughout each webinar. And we'll be sending you guys a link. Well, actually, our external evaluator will be sending out a link to an evaluation for the whole training program towards the end of November, just to get a sense for how things went and how we might be able to improve in the future. So really just want to say a big thank you to all of you. And as Sheila mentioned, we have the contact information for everyone here, all of our panelists. So please do be in contact with your PS or any of our panelists. And it looks like, Livia, did you have a few things you wanted to say before we ended?
Yes, and thank you so very much for giving me. I know that when I had spoken with you, Sheila, I said, oh, I would like to mention this, and I said, okay, at the end I can do this. I just want to say to the new grantees, it can feel so overwhelming, and it's so much to learn at the beginning. And I just want to say what helped me, and it's reach out to your supportive people. Reach out to your prevention specialists at SPRC. Reach out to your grants, your GPO at, forgot the full name, your GPO at SAMHSA, your technical assistants. Please, don't hold back. Really reach out for clarification, for guidance, for questions, for anything. I really do think that if you use them wisely by reaching out, the process can just be a little bit easier for you. That's pretty much it. I was like, that's it. That's pretty much it.
Thank you. Great. Well, so I'll turn it over to Sheila now, but thanks, everyone.
And, okay, let's see. My contact is incorrect.
Yeah, so Livia, I just typed your correct email address, sorry about that, into the chat box. We'll correct it when we post the slides and the recording. Okay. And just wanted to say one last thank you to the panelists and one last thank you to all the participants. And here's Carrie and I's contact information. And as always, the recordings are posted on the SPRC website. Thanks all for joining today and participating.